Let me show you a patient with an inferior myocardial infarction. This is his ECG. You see he has a left bundle branch block. And let's take a look at how you should image the patient. You need to look at the basal inferior septum, so you tilt downwards. You see this echogenic region right here. This is the basal inferior septum, which is infarcted. And then you rotate around the ventricle to the two-chamber view, so you see that the neighboring segments are also affected. The myocardium is thin, echogenic, but I don't stop there, but I keep on rotating until I get to a three-chamber view. And if you look at the posterolateral, inferolateral wall, you will see that there's a scar, a wall motion abnormality there as well. So the infarct extends all the way to that region. But I don't stop there because I also look at color Doppler. Patients with inferior infarcts frequently have functional MR. This patient also does. And then I would look at the right ventricle because the right ventricle is frequently also affected. So here is an angulated view looking at the free lateral wall of the right ventricle. And then I rotate around the right ventricle to an inflow-outflow view so I can better assess the wall motion abnormalities here. In this case, the patient has a normal-sized RV with no wall motion abnormalities. And then finally, I go back to the four-chamber view, angulate more medially to look at the lateral wall because I also want to know if the lateral wall is involved. In this specific case, the patient has a moderate-sized inferior infarct with moderate MR and no right ventricle involvement.